I'm Dr. Barbara Yon. I'm a physician, the Director of Research of the Olmsted Medical Center in Rochester, Minnesota. This study was really all about shingles or herpes zoster and healthcare utilization associated with shingles in adults aged 22 and over. And the reason this is different than previous studies is that we actually use the medical records to confirm the cases, and we use the medical records to do attributable costs. So if a visit didn't say it was for herpes zoster, but herpes zoster was discussed extensively during the visit, medications were given, things were changed, then we were able to attribute that to herpes zoster. So we think this provides us a much more accurate assessment of healthcare utilization for herpes zoster in men, in women, in different ages, in immunocompromised patients as well as immunocompetent patients. The major results are that healthcare costs for herpes zoster in adults 22 and older in the United States are over $1 billion a year in adults, and that's not counting the young children who may have it too. That the cases increase certainly with age, and we know that about 50% of the cases are in people 60 and older that are eligible for the vaccine. About 50% are not in that age group, they're in younger. We know that the healthcare burden as far as visits, even if you have uncomplicated herpes zoster, you make an average of 1.8 visits for that zoster, and you get about 3 prescriptions. That usually includes antivirals and 1 or 2 pain medications. If you have one of the complications of herpes zoster, and almost 20% of people do have a complication, either postherpetic neuralgia, which is the prolonged pain, or they have eye complications, or the Bell's palsy of Ramsay-Hunt, one of those situations. Those people make an average of 7.5 visits to a health professional and have about 14.7, I believe it is, prescriptions over the period of their complications. So very, very expensive. The other part that's important is people say, oh, well, all the costs are in immunocompromised people. That's not true. About 8 to 10% of the cases are in immunocompromised people. 20% of the expenditures are, but that means 80% of that $1 billion is for people's care who are immunocompetent. So this is not a disease of just people with cancer, and we're not spending all the money just in people that are getting chemotherapy. So I think it's very important that we realize it is a very expensive condition that we're talking about. For generalist physicians, I think the takeaway message is that herpes zoster is a much bigger burden than we had realized just on the healthcare system itself. And the concerns about giving a vaccine that are expensive, I think, can be relieved by this study, which says the costs are really quite high, and it looks like it is indeed cost effective in addition to medically effective to give this vaccine. I think it has an important relationship to clinical practice. Because before we've had to guess what was the impact of herpes zoster on adults, and now we have a vaccine that can prevent herpes zoster. So if we're going to think about, is this cost effective, then we have to know what the costs were ahead of time and what they are after we've given the vaccine. So it can be used both in estimating what the impact may be of the vaccine, but then we'll be able to actually do studies using similar populations to see if the costs have gone down as much as we expected. Now, it's important to realize these are only the actual healthcare costs. This doesn't include time off work and all those other things, sort of the social costs. So what we have is a very minimal cost. We know that herpes zoster costs over $1 billion a year in the United States in 2009 dollars, and that's the cost for the immunocompetent people. The immunocompromised people probably add about another $200 million to that cost. So that's what we think this can do, is show you what is the impact, not just in suffering, we've done that in other papers, but the impact in cost, and does it make sense to offer a vaccine that is indeed expensive, but is it going to be paid back in the saved or not necessary healthcare costs if you prevent a case of shingles? I think what they mean for patients is that we as healthcare professionals are going to do a better job of recognizing the tremendous burden and impact of shingles. A lot of times we kind of say, oh, well, it's just shingles, it's a little rash, especially people who've never had it. But I think this study will help people realize that even uncomplicated shingles, the average was 1.8 physician visits for an uncomplicated case and an average of 3 medication prescriptions. So that's not just something you say, well, that's like a cold. Well, no, it's not like a URI. That's much, much higher utilization. When you start getting to people that had any complication, and the most common complications are pain, the postherpetic neuralgia or PHN, and eye complications, when patients had any of those from age 22 on, there was an average of 7.5 visits for their herpes zoster and an average of 14.7 prescriptions for their herpes zoster. So this is a condition that has a major impact, and I think it's going to help us as healthcare professionals be more aware of what the patient actually is suffering. Our next steps are actually now to look at what's happening since the vaccine was approved. The vaccine was approved about a year and a half, almost 2 years ago now. And so what we will be doing is actually active surveillance for herpes zoster. This is in association with the CDC, and we'll be doing population-based active surveillance, looking at some of the non-medical burdens, like how many days of work did you miss, how much pain are you having, how well is your pain controlled, how about depression and things like that. Plus, we will know what is the burden on the healthcare system, and has it changed as people 60 and over at least have been getting the vaccine. We don't know yet. The vaccination rates, unfortunately, are still kind of low. They're about 9 or 10% of eligible people, so we expect to see about a 4% decline. What we're hoping is that very soon we'll have vaccination rates that are 50-60%, and we'll see about a 25% decline in this cost of health care. Who knows, maybe someday we'll get 90% of all eligible people vaccinated. That's what we can hope for.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.